So when someone suffers from an ischemic stroke, the reason why the tissue has died in the brain is because there's a lack of blood flow to the area. Hemorrhagic strokes are a little bit different, right? So hemorrhagic strokes are due to the fact that the blood is not flowing to the area anymore, causing death. However, it's due to the fact that there has been some type of rupture of an artery, and due to the rupture of the artery, there's hemorrhaging of that vessel into the area. Now, that hemorrhaging of the vessel, if you remember from the last time, the cerebrum, the cranium, it just can't take anymore, right? There's no more space in there. So if you're suffering from hemorrhaging, which leads to an hemorrhagic stroke, and one huge complication of that is that the intracranial pressure will begin to increase. So it's important to intervene quickly when someone has a stroke, because for every minute that a person actually gets the treatment, it allows them 2 days of healthy life added on to their life. So that pretty much means that if you delay treatment of a stroke for 15 minutes, you're basically costing that individual a month of their healthy life. So the events that happen in a stroke cause for a localized area of ischemic necrosis, meaning that the area has died. And the area died because you have an occlusion of the blood supply to that place. So an ischemic stroke is the more common type of stroke. It's due to the fact that the blood supply has been decreased, therefore the oxygen has been decreased. A hemorrhagic stroke is a little bit different, like I mentioned before. Those are due to either the rupture of an artery or an aneurysm that has ruptured as well. So the symptoms you have of the stroke is really due to where the stroke is. Now, I will say the most common place that an ischemic stroke happens is right here in the middle cerebral artery. Okay, now typically, because strokes like to occur in the MCA, that's where the occlusion is, leading to, death of the tissue around it. The tissue that is supplied by the MCA normally supplies areas like the arm and the face, right? So you might notice when someone has a stroke, they have that flaccid paralysis in the face, they have that flaccid paralysis in the arm. Okay, typically the stroke is going to affect only one side of the body. Okay, and if other symptoms could include like confusion or trouble speaking. Trouble speaking is a very common symptom, especially if it happens on the left side of the brain where the language center is. And visual disturbances will occur if areas for vision are affected. So, who gets strokes? Well, females do suffer from strokes more often than males do, lots of time due to the fact that they have like hormonal changes, or they might have been taking birth control. But most of those stroke victims are over the age of 65. Now, what are our risk factors? Well, it really depends on the type of stroke you have. So hypertension leads to high blood pressure, right? And a high blood pressure would cause for rupture of an artery. Yes, so more than likely that puts you at risk for a hemorrhagic stroke. Something like diabetes mellitus or extreme lipid in the blood or smoking, normally what that does is leads to atherosclerosis, which then leads to ruptured plaque, leading to thrombus formation, leading to what? Ischemic stroke. Does that kind of make sense, guys? Perfect. So typically with an ischemic stroke, what you have here is a sudden occlusion of blood flow through the arteries, usually due to the fact that there is some kind of thrombus that formed, some kind of clot that formed, or some kind of emboli that broke off and moved into the brain and disrupted an area or obstructed an area. So your thrombotic strokes are usually associated with like an atherosclerotic plaque, or the fact that maybe you've got some type of disorder that your blood clots very easily. Embolytic strokes usually are associated with some type of heart dysfunction, where maybe you have a fibrillation, which causes for very tumultuous movement of blood in the heart, and it causes for clots to form and move from the heart into the brain. But the idea is that you want to salvage the penumbra. So what does that mean? So if I have blood flow to an area, right? And this is the tissue that it's supplying. The idea is that if the blood flow is obstructed, then the area begins to die, right? So the area furthest away from where the blood supply would supply, I guess, will die first. Then the area around it will become hypoxic, and then that area will become ischemic. The moment I'm able to reperfuse, right, I can't save this part because it's dead, but I can save this part and I can save this part because that's not dead yet. It's still able for reversible injury, right? But if I don't reperfuse the area, then this area of infarct will just grow and grow and grow and grow. And the more cells die, the more symptoms you have associated with the stroke and the worse your prognosis is. So the idea is that you want to save all the viable cells as quickly as possible, because if perfusion is restored in time, you can save the penumbra, which is that shadow around the dead area. And the idea is that you want to be able to initiate treatment within the first 3 hours of the stroke, so you have the maximum amount of prognosis. So a thrombotic stroke comes from a clot. An embolic stroke comes from a clot that's outside of the brain, and then a little piece of it breaks off and travels to the brain. The thrombotic stroke would be the clot in the brain. So, which really brings us to our next slide, right? The thrombotic stroke occurs because you have an occlusion in the arteries that are supplying the brain. Okay, thrombotic strokes usually come from some kind of atherosclerotic plaque or some type of, like, if you have some kind of clotting disorder, you have a clot that's forming in the arteries that are supplying the brain or within the brain. TIAs are like a pre-thrombotic stroke, you know, it's like forewarning a thrombotic stroke is near. Embolic strokes are fragments that are going to break off from a clot outside of the brain and then move into the brain. So remember, guys, your brain, very smart, right? And your body always has your back. So the idea is that you have what's called the circle of Willis, which is basically an area that allows for blood to be distributed all throughout the brain with different entries in and different entries out. So your carotids come up and they serve, they enter into the circle of Willis, and then your vertebral arteries come up and enter in, and they serve the circle of Willis as well. So if there's any type of occlusion to the arteries that are supplying the brain, the entire brain won't shut down, because the circle of Willis allows for the blood to be redistributed from different arteries into the actual brain itself. So thrombotic strokes are from localized thrombotic, so this is exactly that. That's exactly correct, right? So the most common place for your ischemic stroke to happen would be in the middle cerebral artery, and we'll look at how that is reflected very soon. So hemorrhagic strokes occur because you've got some kind of bleeding into the brain parenchyma or the brain tissue. So that's a problem, because not only do you have bleeding, which means that the area that vessel was supplying is not going to get any oxygen, but also that hemorrhage causes for a hematoma. And when that hematoma begins to spread, it compresses brain structures. And we already talked about the fact that when brain structures are compressed, they're not functional anymore, right? So overall, when you're looking at hemorrhagic strokes, it causes not just the bleeding in itself, causing the infarct to occur, but also significant increases in your intracranial pressure. So your hemorrhagic stroke prognosis is really going to be dependent on the age of the individual. The younger, the better. The size of the hemorrhage, the larger the hemorrhage, the worse the prognosis, right? If you have something like a pinhole hemorrhage, you're going to be okay, more than likely. And also, depending on how much hemorrhage you have will depend on how much brain distortion or brain shifting it produces. The more brain shifting, the worse off you are, okay? So risk factors like hypertension or a ruptured aneurysm or a bleeding into a tumor, those kind of hemorrhages usually result in hemorrhagic strokes, or can result in a hemorrhagic stroke, okay? So how would you treat the stroke? Well, first of all, you have to figure out what kind of stroke you're having. So you want to stabilize the patient when they come in, and then you want to do a CT scan. Why is it important to do a CT scan? To determine the type of stroke and the location of stroke. What do you guys think? To differentiate. But why is it important to differentiate and visualize the extent of the injury? For sure, Andrew, right? Why is it important to differentiate? Because we want to know the origin. But why is it important to know the origin, guys? Because it affects how you treat it, right? Exactly. Because if you have an ischemic stroke, what's your problem? Obstruction. What do you need to do? Get rid of the obstruction. What are you going to issue? You're going to issue some type of, right, TPA, okay? A TPA is great to administer because it basically breaks up the clot, okay? If you have a hemorrhagic stroke and you administer a TPA, what have you done to that patient, guys? You kill them. Absolutely. Like, absolutely. Right? Because now you've basically given someone who's bleeding something to make them bleed some more. Exactly. Right? So you have to make sure you do the CT scan. That's if you treat without doing the CT scan, that's not very smart. So having the stroke is one thing. You know, the stroke takes, with the blink of an eye, you've had the stroke, right? But it's the ramifications right after the stroke that's truly going to be your issue. So a TPA, Andrew, even if you didn't join late, we didn't actually say what it was. It's called tissue plasminogen activator. It's basically a protein that breaks down blood clots. And it's administered when individuals have some type of occlusion due to a thrombus. You want to break down the clot. Absolutely, right? So the stroke happens, boom, you know, you're in a bad place. But really what happens after the stroke is what is harder on the individual. So at first you'll notice these motor deficits, right? They'll have like a flaccid paralysis maybe on one side of the brain, one side of the body, you know, depending on where the stroke happened. And they'll probably have some kind of like sensory disturbances as well. So let's examine the brain a little bit. So do you guys know what a homunculus is? A homunculus is a drawing that represents areas of the brain and where they feed the body, right? So for example, you can see here that this area of the brain is feeding the legs, this area of the brain is feeding the arms, this area of the brain is feeding the head, okay? So if you look here, you'll notice that your internal carotids come up and then it splits into your anterior portions to serve what's called the anterior cerebral artery. And then you have a posterior portion which serves a more posterior area of the frontal part of the brain, okay? And the medial surfaces. The vertebral artery comes up and it feeds the posterior inferior aspects of the brain, like the cerebellar, which is back here. So if you have, okay, before I even say that, right? The most common place for your stroke to happen, ischemic stroke, is the middle cerebral artery. So if this becomes obstructed, blood is not going to get to flow to areas of the brain that supply the arm and the head, which is why when people have stroke, the most common thing you normally see is them going flaccid in the face and the arms, right, guys? Because the MCA feeds there, and that's the most common place to be occluded in an ischemic stroke. But if it occludes, right, let's say it occludes before it splits, like in the internal carotid, in that case, you'll probably see blockages to the MCA and ACA. And with that, the legs, the arms, and the head will all become unable to respond to stimuli. Does that make sense, guys? Okay, so here's something else. The language center is on the left side of the brain. You have what's called the Broca's area, which is fed by the anterior portion of the MCA. And then you have the Wernicke's area, which is fed by the posterior portion of the MCA. So here's the deal. The language center helps us to speak, right? Now, language deficits are very common stroke sequelae. All right, so aphasia is basically a disorder that's associated with the fact that there's some type of lesion or disruption in the primary language areas, which would be the Broca's area and the Wernicke's area, right, guys? So the Broca's area, it is all about helping us to have expressive language, right? So, which means like literally being able to express what you're saying. So if someone suffers from a Broca's aphasia, they have what's called an expressive aphasia. They know what they want to say, but they have difficulty speaking it and writing it. A Wernicke's aphasia is a receptive aphasia. That's where you have no problem with flowing speech. It's just very senseless, right? You have like no idea, like what you're saying doesn't make any sense. And depending on the degree of damage to the brain will depend on whether or not you are conscious of the fact that you're speaking in gibberish or not. So if you have some type of obstruction, guys, and that obstruction is before the MCA splits, you can have a combined aphasia of both Broca's and Wernicke's. But if the obstruction is towards the anterior portion, you'll just suffer from Broca's. If it's towards the posterior aspect of the MCA, you'll just suffer from Wernicke's. Does that make sense, guys? Okay, perfect. All right. So I'm going to play 2 videos for you, right? So I'm going to stop my share.